So our next task is oral candidiasis. The background history. There's an 8-year-old who has been brought to the hospital, or brought to the GP surgery by her mother. So you are actually talking to the mother. The presenting complaint, the child has got soreness in the mouth. The child has had soreness in the mouth for the last 5 days. He has got asthma and he uses a blue and orange inhaler. A blue inhaler is salbutamol, as we know. An orange inhaler is a combination of a long-acting beta agonist plus a steroid inhaler. The asthma is well controlled. The last time the child had an asthmatic attack was about 6 months ago, and that was the last time he used a blue inhaler, that is a salbutamol inhaler. He does use an orange inhaler, 2 puffs in the morning, 2 puffs in the evening. Uses inhaler, does not use a spacer device. Does not rinse the mouth after using the inhalers. Questions: why did it happen? Can the child still go to school? Why did it happen? Can the child still go to school? In this particular task, we're going to take the history of the soreness in the mouth, which is an oddipara of soreness in the mouth. When did this start? The soreness in the mouth, is it when the child is eating, or is it there all the time? Anything that makes it worse? Of course, when eating or drinking. Anything that makes it better? Other than soreness in the mouth, are there any rashes or ulcers in the mouth? Does the child have got any swallowing difficulties? Is it esophageal candida, or is it only oral candida? It's important to exclude esophageal candida where there is difficulties in swallowing. Is the child able to eat and drink? Has this happened before? Or is this the first time it has happened? Have you looked into the mouth of the child? What have you seen? Is there any ulcers? Is there any patches? Any bleeding in the mouth? Then we're going to take the history, the pediatric history, the 6 infections, the UTI, upper respiratory tract infection, or acute otitis media, the gastroenteritis, the meningitis, pneumonia. Make sure I rule out dehydration. Is he able to eat and drink? Is he passing urine normal? Do the lips look dry? Is he generally lethargic? The rest of the history, the P bind. P is pregnancy. Any problem during pregnancy? B is birth. Any problems during delivery? I is immunization, up to date with all vaccination. N is neonatal period. Any problems after delivery? After how many days did you go home? Any breathing problems after delivery? Development. Are you happy with the way the child has been developing so far? Any concerns with his development? Then you do the PMAFTOSA, the ICE, the effects of symptoms, and summarize the positive history. Examination. They will give you a picture, as you can see on the screen, that is, of course, oral thrush. Explain the diagnosis. The child has got an oral thrush or oral candidiasis. Of course, it's a fungal infection. The likely cause in this situation is the steroids inhalers. It's taking an orange inhaler, which is a combination of steroids and the beta agonist medication, or sametrol. The steroids in this inhaler is what usually causes what? Candidiasis. Because when you use an inhaler, the particles may stay in the mouth. And this is important that after using the inhaler, you rinse the mouth to remove those particles. If those particles stay in the mouth after using each inhaler, then there is a risk of developing what? Oral thrush. Management. Because you have developed some oral thrush, your medication may need to be reviewed. We need to send to the pediatrician to review the medication, and usually they would reduce the dose of the steroid medication. You're going to prescribe topical antifungal, miconazole gel. Going to prescribe some gel called miconazole gel to treat the oral thrush. Give advice. Advise good oral hygiene. Because they cause a steroid inhaler, it's important to rinse the mouth after using the steroid inhaler. It can be even more better advised to use a spacer device, because the spacer device may prevent the steroid particles to go into the mouth. So use a spacer device. And even after using a spacer device, still better to rinse the mouth. And explain that the steroid might need to be reduced. This is why you're referring to the pediatrician. Offer a leaflet about oral candidiasis. Thank you.